the third, fourth and lateral ventricles of brain. So in this we will be discussing the competency, that is parts, boundaries, features of third, fourth and lateral ventricles. Ventricular system is the remnant of the space in the middle of the embryonic neural tube. It is an interconnected series of cavities that extends through most of the central nervous system. There is a pair of lateral ventricles in the telencephalon, that is one in each cerebral hemisphere. Then a midline third ventricle in the diencephalon. A fourth ventricle straddles in the midline between pons, medulla and cerebellum, and cerebrospinal fluid is secreted within the ventricles, fills them and flows through the fourth ventricle through three apertures to fill the subarachnoid space. So the picture showing the lateral ventricle with different horns, that is the anterior horn, posterior horn, then inferior horn and body. Lateral ventricle. Each lateral ventricle is C-shaped in structure. This C-shaped curves from inferior horn in the temporal lobe through the body in the parietal lobe and a bit in the frontal lobe. It ends at the interventricular foramen. Each lateral ventricle joins the third ventricle. Along this C-shaped course, two extensions emerge. Posterior horn extends backwards into occipital lobe. Anterior horn extends farther into the frontal lobe. The expanded area where body and inferior and posterior horn meet is called as the atrium. Each lateral ventricle represents the cavity of embryonic telencephalon vesicle. Telencephalic structures like the caudate nucleus, the hippocampus border much of it. Thalamus, a derivative of diencephalon, also forms part of the floor. Each lateral ventricle represents the cavity of an embryonic telencephalic vesicle. Telencephalic structures, caudate nucleus, hippocampus border much of it. Thalamus also forms part of the floor. Then we come to the third ventricle. It is a midline slit in the diencephalon. Its walls are formed by hypothalamus and much of the thalamus. Thalamus grows, pushing together in the middle of the third ventricle, forming an adhesion, that is interthalamic adhesion. The third ventricle connects with the fourth ventricle by a small cerebral aqueduct through the midbrain of the brainstem. Then we come to fourth ventricle. Fourth ventricle extends from the cerebral aqueduct to the mid-medullary level, where it narrows down into central canal of the caudal medulla and the spinal cord. So it is also called rhomboid fossa, formed by posterior surface of pons and medulla open part. Floor has grey matter lined by epiderma. Pons part. On either side of median sulcus, there is median eminence, limited laterally by superior fovea, as you can see in the picture. In the upper part of superior fovea, there is a pigmented area called as substantia ferruginea. Superior fovea is lateral to facial colliculus. Vestibular area lies lateral to superior fovea. Stria medullaris divides the floor of the fourth ventricle into two triangles. Medullary part. It looks like calamus scriptorius. Median eminence presents hypoglossal triangle bounded by inferior fovea. Below inferior fovea, there is vagal triangle. Contains dorsal nucleus vagus. Base of the vagal triangle is crossed by funiculus apparens. Area posterior is below funiculus apparens. Vestibular triangle is lateral to vagal triangle. Inferolateral margins are called as tinea, and the two tinea unite to form what is called as the obex, as you can see in the picture. So that's the picture showing the fourth ventricle, also called as rhomboid fossa. Fourth ventricle reaches its widest extent at the pontomedullary junction, where it extends into lateral recess on each side. The tent-like roof of fourth ventricle pokes up into the cerebellum. The ventricular system communicates with the subarachnoid space through three apertures of the fourth ventricle. Two lateral apertures at the end of each lateral recess and a median aperture above the point where fourth ventricle narrows down to the central canal. Then we go on to describe the competency, the anatomical basis of congenital hydrocephalus. Congenital hydrocephalus is also called ventricular megaly. It develops in the fetal and infancy periods. The most common causes of congenital hydrocephalus are obstruction to the cerebral aqueduct flow, for example, Arnold-Chiari malformation or Dandy-Walker malformation. Patients may stabilize later years due to compensatory mechanisms, but may decompensate again, especially following minor head injuries. During these decompensations, determining the extent to which any new neurological deficits may be due to new acute event compared with hydrocephalus that may have gone unnoticed for many years is difficult. Thank you.